Good evening. My name is Dr. Michael Bigham. I am the Chief Quality Officer at Akron Children's Hospital, and I have two lovely guests who I'll introduce in a moment. And together, we're really excited to share this time with you together to talk about something that's on the minds of so many of us, and that is the new approval of the Pfizer vaccine for children ages 12 to 15. At Akron Children's Hospital, we've been very committed since the vaccine first came out. We've been committed to getting the vaccine to as many individuals as possible under the approved guidelines and removing any barriers to the vaccine. And what we've realized is that we've been able to take the vaccine into multiple different venues like schools and community partners and within the walls of our own hospitals and hospital campuses. And one of the barriers, aside from making the vaccine available, has been folks being uncertain about the vaccine, being uncertain about whether or not the vaccine is safe in their own personal situation, safe for somebody in their family member, in their family. And one of the things that we'd really like to take the opportunity tonight to do is to address some of those concerns, some of those questions that have come up for many of us. And what I'd like to do is I'm going to just share a couple of opportunities for ways that folks can get connected to Akron Children's Hospital and to get access to the vaccine for individuals of any age, but specifically those children who were newly eligible now at age 12 to 15. So those opportunities will exist at akronchildrens.org/COVID vaccine. And I would encourage individuals who are interested in getting their child scheduled for the vaccine or even themselves scheduled for the vaccine to sign up on that website. And what that'll lead you to is existing opportunities to book a vaccine either in the Akron campus of Akron Children's Hospital or on the Boardman campus of Akron Children's Hospital. And we'll also link you to the numerous other venues where we'll be offering vaccines. And as more vaccine clinics get open, they'll include drive-through vaccine opportunities. They'll include vaccine opportunities potentially at your local school. Again, we want to get vaccines available to as many people in as many ways as possible. So beyond the availability of the vaccine, I want to introduce two of my guests. The first is Dr. Michael Forbes. He is the chairman of pediatrics at Akron Children's Hospital, also a pediatric ICU physician, and an all-around terrific human being and a very thoughtful individual. And additionally, I'd like to introduce Dr. Eric Robinette. Dr. Robinette is an infectious disease specialist here at Akron Children's Hospital, also a terrific human being. And Dr. Robinette has been very closely tied to our learnings and our science behind the vaccine, as well as our vaccine distribution. And so I'll let, beyond that introduction, what I'll set for tonight's discussion is I'll allow both Dr. Forbes and Dr. Robinette to introduce themselves in that order, and then they'll each give a couple of opening thoughts. And then subsequent to that, I'll be moderating a question and answer session. We've been receiving common questions from many of you. And so I'll take the chance to read off those questions, and I'll either ask Dr. Forbes or Dr. Robinette, or sometimes both, to answer those questions. And so hopefully after maybe 30 minutes or so, we'll have had a time to build your knowledge and understanding around the vaccine and hopefully answered some key questions that might be pressing for you. So Dr. Forbes, please introduce yourself and tell us a little more about some opening thoughts.
Sure. Thank you, Mike. I really appreciate the opportunity to talk a little bit more about vaccines. We're living in historic times. As you mentioned, I'm a pediatric ICU doctor by training. I did pretty much all my training in Pittsburgh and came here in 2006 to Akron Children's, where I've worked in the ICU since then. As you also mentioned, I'm the current chair for the Department of Pediatrics. Continue to practice in the ICU, and I'm also privileged to be the president of the medical staff. So we have seen lots during this COVID year, and I want to emphasize that, again, these are historic times. We have watched over the course of a year, we've been able to use technology that's almost 15 years old to generate a new vaccine within 9 or 10 months. No matter what we think down the road, that's a pretty magnificent medical feat. And I think we ought to appreciate that for all the work that's gone into developing all of these vaccines. So I'm glad to talk about it some more tonight.
Great. Thank you, Dr. Forbes. Dr. Robinette, do you want to tell us a little bit about yourself and maybe some introductory thoughts?
Sure. Again, I'm Dr. Eric Robinette. Mike mentioned that I do pediatric infectious diseases at Akron Children. I did my training in infectious diseases in Cincinnati at Cincinnati Children's Hospital, I've been up to my elbows with Dr. Bigham here doing the COVID vaccine initiative. So I've been in the clinics, I've been given shots, I've been watching, talking to patients that have had mild reactions in the clinic and people that have called after with questions and answering people's questions before the clinic. So I really have had a front row seat to the vaccine rollout. And I'll just echo what Dr. Forbes said. No pandemic in history has been fortunate enough to have vaccines this effective developed this early. And in all the history of humanity, vaccines are the most effective tools human beings have ever devised to fight infections. Now, that doesn't mean that we should accept any vaccine without question, but I hope that you'll learn from us tonight. And what I believe to be true is that the science around these vaccines has been very thorough, very careful, very robust, and we have good reason to believe that these vaccines are safe and effective, and share why we think that with you.
Okay, great. Thank you. Appreciate both of you for your time, and let's get right into questions. I think maybe one more important fact that I think our audience should understand about Akron Children's approach to these conversations around vaccine is we're pretty committed to being open and honest. I think it's not useful for us or useful for anybody for us to be misleading or disingenuous. What we want is to share what we know. We'll be honest about that. We also will share what we don't know. We've done lots of analysis around that, so we'll do some extrapolation of the data as we know it. But again, we're very committed to a long-term trust with our patients and families, and we certainly aren't going to be misrepresenting anything, and we'll be as forthright as we can about what we know and what we don't know. And so I know Dr. Forbes and Dr. Robinette are committed to that. And so with that being said, let's first get right into Dr. Robinette. Maybe you can start us off with the question on everybody's mind. So the 12 to 15-year-old age group is now eligible under the emergency use authorization for the Pfizer vaccine. And I think what many folks want to know is how in the world is this vaccine different for children than adults? And so what can you tell us, Dr. Robinette?
So, children are not little adults, right? I mean, that's sort of something that we talk about a lot in pediatrics, right? And so we have a higher, children are different. Children also have different ability to consent to enroll in a clinical trial, right? And so it's very common and typical for vaccines to do the initial studies in adults and then sort of work your way down by age. And the reason is because although they are not the same as adults, someone who's 12 is a lot more similar physiologically to someone who's 18 or 20 than someone who's 6, than someone who's 2 years, than someone who's 2 months, right? And so we sort of work our way down systematically with the most analogous group. And so we have an approval for this vaccine in 16 to 18-year-olds and up, and in adults, of course. And so 12 to 15 is the next closest group. And largely, what we understand about the primary difference as it relates to vaccines between a 12-year-old and a 16-year-old or an 18-year-old is generally that they just mount a more robust immune response. And so, sometimes that can mean that the mild to moderate side effects, the immediate side effects of a vaccine are a little bit more significant because what we're trying to do is cause them to mount an immune response. And some of those side effects are the short-lived and non-serious consequences of that immune response that we're trying to create. And what they saw in the trial, as Dr. Bigham, to be transparent, we have the press release from Pfizer and the FDA. I haven't yet seen all of the full data reportage that I expect will be available as the ACIP meets. But What they have reported was that in the 1,000 kids that they tested this vaccine on, they saw 100% efficacy, meaning nobody that got the vaccine developed symptomatic COVID, and a number of patients who did not get the vaccine did. And they reported a very similar side effect profile to what they reported in adults. So would I be surprised if there's 5% more of fever or 3% less of arm pain or something like that? No, I would not be surprised by that, but it appears that largely the common side effects, both in nature and in degree, so the side effect itself and how severe they are, is very similar to the adults from what they reported from their study in 12 to 15-year-olds.
That's great.
Great, thank you. Maybe Dr. Forbes, I'm going to have some more vaccine questions for you, Dr. Robinette, but maybe Dr. Forbes, I think one of the questions that we have received that I think maybe you've even been asked before is, we hear a lot about how COVID-19 is a serious illness in adults and with a high rate of death, particularly in the elderly. Could you share a little bit of your experience about COVID-19 in children and maybe the post-COVID-19 MISC that folks might have heard about? And what is your experience both inpatient and what are you hearing about the ambulatory COVID-19 disease? And does a child really need a vaccine, knowing what we know about the disease?
Yeah, that's a great series of questions there, Dr. Bigham. For us in the intensive care unit, we were most familiar with MISC, the multiple inflammatory syndrome that affects children. There was also some early evidence that probably this was happening in adults too, and it was kind of hard to tease out. We have to remember that the coronavirus is not new. This is a new coronavirus, and so our human genome, our immune response to coronavirus has evolved and developed over many years. This is a brand new player. And so the immune response is not as predictable, frankly. In the ICU, when I hear a child with coronavirus, they have a cold. What we saw with MISC was an immune system that went completely haywire. It wasn't just a snotty nose with a fever and coughing. It was heart failure. It was fever to 104 for hours and hours, and for some kids days, renal failure, respiratory failure, just again, multiple inflammatory and multiple organ system failure. And what was most in real time, what was also distressing, not that being so critically ill, as a young child isn't bad enough, many of the families were just stunned. Because what they experienced was that there was COVID in the home, or maybe COVID in the home, but the child who's now in the ICU was only mildly ill. They may have been ill a day and a half, maybe 2 days, or really not that ill at all. But an uncle was sick or dad was sick, and now this child is on a respirator and heart failure, multiple organ system failure, and they were still stunned. And I mean, when we peaked, we probably peaked here in the area. December was probably our worst month. Eric, you can correct me on that. And then in January, we saw this surge of MISC. And honestly, many of the families just had no idea why they were even in the ICU. And the mantra I heard was, they're not that sick. They were not that sick. How can they be, so critically ill now? And I think it really has broadsided everyone. So as much as we've heard about COVID for the past year plus, I think there are still people who didn't believe maybe that it was as pervasive and can be as dangerous. And the reality it is. And so, to your question, then why vaccinate children? Because most kids really either have no symptoms or they have a mild cold, and so it's not a big deal. One reason, frankly, is to stop new cases. I think the sooner we can eliminate new cases, the better. And as Dr. Robinette pointed out, vaccines are the answer to eliminating new cases. And so you want to eliminate new cases. You also want to make sure, because we've learned in the last year, that kids can carry it and they can be silent spreaders of the infection. They don't know they're sick, you don't know they're sick, and they can spread it. And so if you can vaccinate children and prevent them from contracting and spreading the disease, you can eliminate new cases, right? So I think that's one of the main things. And the other thing is, if kids want to participate in sports and go on with their life as we as adults do, that's certainly another reason to go ahead and get vaccinated, eliminating new cases, get rid of the cases in your school, your neighborhood, your family, so we can all get back to living our lives the way we want to. So I think it's really important to make sure that we can vaccinate kids, and now we can vaccinate the 12 to 15-year-olds. And if I could add, Mike, I think the transparency around this pandemic and how we're doing the vaccinations, that's unprecedented too. I mean, we have lots of vaccines, right, in our armamentarium for kids and adults. We don't get all this detail on CNN like every week and a half, right? And so the transparency, I think, is fantastic. So you hear about every little blip, and we didn't say, okay, it works in adults, let's just vaccinate all children. To your point, Eric, we said 12 to 15-year-olds. And then we'll make sure it's safe and effective, and we'll do it the way that we have always done it in science, with just be very, very careful and respect the facts. So,
great, thank you, Dr. Forbes. Dr. Robinette, anything you want to add to Dr. Forbes' comments?
Yeah, I mean, I think one of the things that's been very confusing for people, and it's a question that I get a lot, but it's very important to the case that Dr. Forbes just made, is, does the vaccine prevent people from transmitting COVID-19 to others, right? And I think it's really important to understand that there are things that we believe are very likely to be true, and then there's things that we know for sure are true, right? And right now, the information on to what extent does the vaccine prevent people from transmitting COVID-19 to others, information on that is in a transition state from what we very strongly believe is likely to be true to what we know to be true, right? So I saw a study that showed in adults that the vaccine made a 55% reduction in the rate of asymptomatic positivity, right? Meaning, so their chance of transmitting it asymptomatically. So we have a 99% reduction in death, 99% reduction in hospitalization, maybe a 95% reduction in symptomatic COVID, and a 55% reduction in your ability to transmit that in adults, for example. Now, that is dependent on antibody levels, and if anything, children appear to be making even higher antibody levels, so that you could make the case that it's likely children may have an even better response to the vaccine as far as transmissibility is concerned. But we don't know that yet. We don't have proof, and we want to be open about what we know and what we believe. But there's a large, strong body of evidence to suggest that there's a very significant positive effect that the vaccine has on reducing transmission of COVID-19. How much it is so that we can make decisions about when you can stop masking and when you can stop distancing and what your risk is in a particular scenario, that's for the science to hammer out that level of detail. But on a population level, I don't think anybody that understands vaccines really doubts that this vaccine is reducing the transmission of the virus.
Oh, great. Thanks, Dr. Robinette. I appreciate it. So, Dr. Robinette, while your mic is still on and you're still hot, let's talk about a question that I know I've asked you about privately, and I certainly regard highly, is I think you mentioned a little bit about a predictable rate of fever and maybe some chills and things like that, as I think you described the children generating perhaps even a more robust immune response because of their youth and their sort of really active immune system. But I think one of the things that I've asked you about that our audience is certainly interested in is trying to understand what long-term consequences of vaccines might be in play. And so I don't know if you're willing to sort of talk us through what we know and what we can surmise about long-term consequences of this Pfizer COVID vaccine.
Yeah, so that's a great question. I mean, the long-term complications in some ways is the hardest question to answer, right? Because the only way that you can do it is with time, right? You can only be patient and surveil people over time. And I can tell you from looking at the study design, not just the study design of the original trial in adults, but also from looking at really the unprecedented level of post-vaccination side effect and symptom monitoring that the CDC and the companies have been doing, that they have been watching like a hawk for long-term effects, and they really haven't found any so far. Now, you could say we're not that far out. We just started giving the trials in, October 2020, so we're, 6-7 months out, and that's true. The other thing that's important to know is there aren't a lot of long-term complications from vaccines, right? So the way a vaccine works is it's designed to basically cause your immune system to believe that it's under attack from an infection without actually allowing you to have the infection. And that causes your immune system to generate a protective response against that infection without the risks of the infection. And so generally speaking, like an infection, a vaccine, most of the complications of a vaccine happen within the first days to weeks to months after you get the vaccine. So I was actually thinking about this other day, and it's even hard for me to come up with vaccines that have common long-term complications. It's just not very typical of vaccines. So does that mean it can't happen? No. But does that mean that it's likely to happen? I think it's not super likely based on the data that we have right now. One of those things that we have to balance with the long-term complications is the rare complications, right? So we've tested this, and at this point, I shouldn't say tested, we have administered the vaccine to millions, literally millions of adults, tens of millions. And so we have a pretty good grasp of what the side effect and even the rare complications are in adults, and there's not very many, is the honest truth. There's not likely to be any in 12 to 15-year-olds based on all of the reasons that we've talked about, but we've only vaccinated 1,000, right? So can we say that there's not a 1 in 100,000 complication for this vaccine? No, we can't say that. But anytime you're measuring a vaccine, you're not measuring against nothing. You're measuring against the risk of the disease, right? So we wish that COVID-19 didn't exist and there was no risk of getting COVID-19. And obviously, in that circumstance, we wouldn't need a vaccine or use a vaccine. But in this circumstance, there is a risk, and Dr. Forbes, I think, spoke to it pretty eloquently. One of the known risks is the MIS-C. And so we're really weighing, is the vaccine safer than those risks of the disease? And I think there's plenty of evidence to indicate that it's extraordinarily probable that the vaccine will prove to be safer than the risk of the disease based on the science we've done.
Great, thank you. And maybe a follow-up to that question is we talked a little bit about long-term side effects. I know one of the questions I get asked, and I know you've been asked, is were there corners cut in the development of this vaccine? I know Dr. Forbes alluded to the fact that this is science that's been many decades in the making. Maybe Dr. Robinette first and then Dr. Forbes in follow-up. Can you just share your perspectives about maybe to allay any fears or address that question of what corners may have been cut in the development of this vaccine?
Yeah, so I'll give you the short answer, and my short answer is no. I don't think that there were corners that were cut, but I'll give you the longer answer too. So how did they get this done so fast? So it's important to know that they've been working on this for a decade, right? They've been working on ever since the SARS-1 kind of scare, where it almost did what SARS-2 did actually do, and everybody was really realized that we were in a bad situation. They've been working for decades to figure out how do you get faster at developing vaccines. At that time of SARS-1, the record was a decade. It took a decade to develop a vaccine, right? And by the time the Ebola pandemic came around in, I think it was 2017, in West Africa, they did one in 18 months, right? And that was the product of a decade of research, over a decade of research, right? And so it's not so surprising then that when SARS-2 COVID comes around, that they did it in 12 months or they did it in 9 months, right? That was an incremental improvement, and that was a result of them working on something, not just pulling a rabbit out of a hat. And then the other thing is, it's important to understand, how did they speed up the clinical trials, right? So one of the ways they did it was they did a lot of things in parallel. So for example, BioNTech had actually 8 different candidate vaccines. And what they would normally do to make it cost effective is they'd pick the one they liked the best, they'd test it. And then if it worked or didn't work, they'd test the next one, and then the next one, and then the next one. Instead, they said, we're going to test all 8 at the same time. And we're just going to pick the one that's the best, right? And when you have the kind of money that the world governments and the companies were willing to put at this type of problem because of the nature of the pandemic, you can do stuff like that. You can also do things like start building a factory even when you don't know if the vaccine is going to work, right? Because factories are a long lead item. They take time. So they did a lot of things like that to speed that up. The mRNA technology is amazing. You can make the vaccine really fast. You don't have to wait for it to grow in chicken eggs. That's another thing that sped it up. So there's all things that sped this up that are explainable by things that people did on purpose to speed it up, that weren't just like, oh, we're going to waive this oversight, we're going to waive this protection, we're going to waive this safety feature. If you study vaccine clinical trials, the trial of the Pfizer and the Moderna and the Johnson & Johnson vaccines, they were huge. They were bigger than most of the clinical trials that we do for most vaccines, to be perfectly honest. And this is a really pretty large extension. The 1,000 children, the 1,000 12 to 15-year-olds is pretty large. Most of those little studies are in a few hundred patients. So there's nothing about the size of this trial that was, cut corners. There wasn't anything about the way they did the trial that was rushed. They did things in parallel instead of in sequence, as I've described. The one thing that, is a fair point is time. As I pointed out before, you're in the middle of a pandemic. You can only wait so long. You have to decide. People were dying in December then, right? And so we had to decide, how long do we wait on the follow-up data before we release it? And, to their credit, I would say that all of the data on this would have led to an FDA approval back in December, except for one thing. And that one thing is that the FDA requires 6 months of follow-up data for an approval, right? So I believe it's very likely that, like, the day the data turns 6 months, this is going to go from an emergency use authorization to an approval. Everything about it would have met approval criteria except for the time. And that's just us being transparent. And you've heard what I think about the long-term side effect issue.
Great. Thanks. Dr. Forbes, anything you want to add to that?
The only thing I would add is, one of the things that added to it too, strangely enough, to some degree, I think was social media. I think that at the end of December of 2019, when the lab in Wuhan made the announcement, they published the genome, right? They published the genome almost right away. And so by the time, second or third week in January of 2020, when we detected this gentleman in Seattle with COVID-19, the genome was public knowledge, right? It's already on Twitter, it's in Lancet. And so we were able to use that genome to make candidate vaccines very early. So it's just so different now. And I think what I don't want is for people to think that we're kind of cobbling something together in a hurry and using cutting corners. It's almost as if we had the basics to do this. We got challenged, and frankly, kudos. The whole world came together and figured out how to pull something together that's going to stop, a lot of these the deaths. And so I think it's a real triumph in many ways. I do want to add that I think one of the other things that we sometimes get accused of, I guess, if you want to think of it that way, is that we're kind of pushing the vaccines. I think what we're doing in healthcare is we're really pushing prevention, right? We think you nutrition, how you sleep, how you live, your built environment, all of those things still matter. And people are doing research around nutrition in COVID as well. And once the evidence is strong enough to make recommendations about it, we're going to make recommendations about that too. But, micronutrients and multivitamins, all that stuff's being studied. None of them so far have the impact that vaccines have. And so, maybe we'll find something. But right now, the answer is vaccines. And so, we're going to encourage that.
Great. Thank you. Thank you, Dr. Forbes. Maybe, Dr. Forbes, while your mic's still hot, I wonder if we could touch on something that's, I know, a little bit disheartening for you, but I'd like to think for a minute, if we could, just about vaccine hesitancy, and as you know and experience, and I've learned, and we're reading a lot about, that the vaccine hasn't been universally embraced in all cultures, all races. Can you share your perspectives about this? You're obviously a Black man. You're a scientist. I know that you have experiences that are useful to share, and I think maybe speaking to those and speaking to maybe audiences that might be a bit more hesitant to get the vaccine, if you could speak to that, that'd be helpful.
Sure. Yeah, it's. Again, as pediatricians, we focus on prevention, and we can talk science and data and the scientific method and all of those things. But in the end, I think we've learned that public health is about private choices, and it's about how you feel. And your lived experience, particularly in the African American community, where systemic racism and the impact of American slavery has left a mark right? I mean, Condoleezza Rice calls it our congenital disease. This is what we're going to limp along with for a very long time. And so we can't deny the impact of systemic racism on many communities, particularly in the African American community. The Tuskegee experiment gets brought up. In my family, when we talked about the vaccines before it was developed, Tuskegee was brought up again. And the fact is, Tuskegee should have absolutely never happened. It was horrific. It did happen. And it's painful, and it's part of the harsh history of living in the United States and living in the world. But today in 2021, as a scientist, I can say that the likelihood of a Tuskegee or a Tuskegee-like event is extremely low. And because we've learned from it. I don't think we're going to tell people how to feel about Tuskegee. It should cause you to be angry. It was unjust, it was unfair, and injustice should trigger anger. But once the anger has been properly processed, we have to look at what's happening. In my family, I lost my brother to COVID last spring, and it was terrible. And when I went to New York City, I saw a different part of the country. It looked apocalyptic in New York City, as I've shared with folks, because there were so many people dying. When I came back to Akron, there weren't that many people dying. And so it was still debatable whether COVID was even real, whether it was, manufactured or not. And so the reality is that a lot of this depends on how people feel. My encouragement would be to take a look at, certainly you can question what's happening in the news. We are truth tellers. That's what we do. We're going to tell you good news if it's true. We're going to tell you bad news if it's true. And, the bad news a year ago was that we were blindsided by a horrible pandemic. The good news in May of 2021 is we have an answer. We have an answer. And so, I think that you're going to have to make that personal choice to protect your children, protect your family, protect your community. And my appeal to my family, to the Black community, is protect our elders. Protect our elders. There were so many of our elders that we lost already due to the pandemic. There are so many small businesses in minority communities, small business owners that will never, ever come back because of the pandemic, because of all of these new cases. And so to go back to what I had said earlier, the goal of the vaccine is many, but one of them is to eliminate new cases. The more people that are vaccinated, the more children, 12 to 15, that are vaccinated, the less new cases we're going to see. And with less new cases, we can get back to our lives. And so I absolutely respect the fear. I absolutely respect the skepticism, because things have happened that should have never happened. But today, in May 2021, we have a highly effective, very safe vaccine that can protect our most vulnerable citizens. So I encourage you to get it and protect yourself, your family, and your community.
Great. Thanks so much, Dr. Forbes. It's hard to put a bow on this conversation any more neatly than you just have. I think maybe I'll share a personal experience as well, and that is I've got two children. I've got a 16-year-old and a 13-year-old, and my 16-year-old has now gotten both of his vaccines, and my 13-year-old, as soon as we're done with our conversation, is going to get registered to get her vaccine, and I again, I feel like I understand the science as well as we can. I feel like I value the health and wellness of my children. I value the health and wellness of the people that my children are around, and I just again, I feel confident in this vaccine and the impact that it can make on helping our society emerge from the pandemic. So I'll maybe have that be my sort of closing thought. Dr. Robinette, anything else as we're wrapping up that you want to make sure our audience hears and understands as we're finishing up?
You guys said it awfully well. I kind of alluded to this in my opening statement, but I'll just close with it. All I do for my job is treat infections. That's all I do, right? And if you asked me if I had to give up every tool in the medical armamentarium except for one, for fighting infections, what's the one that I would keep? The one that I would keep are vaccines, right? Vaccines have taken the deadliest disease ever to afflict humanity, smallpox, and locked it in a freezer in Atlanta, right? There's really, and they're hard because, you know, normally the way we think is if I'm well, I don't need a doctor, and I only need a doctor when I'm sick, and that's normal. That's the way we all think, right? Like, you know, but the way that infections work, by the time you are sick, it's too late. And so vaccines are, the power of a vaccine is that it prevents that from ever happening. And so it is a little bit convoluted. It's a little bit not the way we normally think about disease, but it is the way that we have to think about infectious diseases. And so I agree with Dr. Bigham, Dr. Forbes. I believe in this vaccine because of what I've seen personally, because of the data that I've seen, and I would strongly encourage you to get it.
Well, thank you. On behalf of Akron Children's Hospital, on behalf of the families and patients that we have the privilege to serve, I appreciate Dr. Forbes and Dr. Robinette, you taking the time to share your intellect, your knowledge, your passion around the health and wellness of our communities. I would encourage folks who are participating in this discussion to go ahead if they would like to get signed up. They can go to the akronchildrens.org website /COVID vaccine and get themselves or their child, now 12 to 15, signed up to get the vaccine, but certainly 16 or older as well. And we appreciate, again, the conversation. We appreciate the will for those participating to learn a little more, to have shared their questions, and hopefully we've gotten folks a little bit closer to confidence in the vaccine, a little bit clearer on what we know and what we don't know. And I really appreciate the chance to have the discussion. Thank you both so much, and have a lovely day.
Thank you, Mike, for having us.